Nobody in the hospital knew her real name, not her actual name. The one stitched on her badge, Mara Calloway, RN, was real enough to pass a background check, real enough to fool a payroll system, real enough to keep the wrong people from ever looking twice. But it wasn't the name the people who mattered most had called her. Those people were dead, and Mara intended to keep it that way, for everyone's sake, including her own. She had worked the overnight shift at Mercy Ridge Medical Center in Portland, Oregon for 2 years, 3 months, and 11 days. Not that she was counting. She wasn't sentimental. She was precise. Precision had kept her alive in a burning valley in northern Syria when every calculation said she should have been dead. Precision was the only religion she had left. To the rest of the night staff, Mara Calloway was simply the quiet one. The one who moved like smoke through the corridors at 3 a.m., checking vitals that nobody else bothered checking, adjusting 4 drips by fractions of a milliliter that no protocol demanded. The one who never gossiped in the break room, never complained about the administration's staffing cuts, and never, under any circumstances, talked about where she had been before Portland. What they didn't know, what no one alive in that building knew, was that the night everything changed had already been set in motion 3 weeks earlier. It began as catastrophic nights often do, in absolute silence. The Pacific Northwest winter had descended on Portland like a punishment. A freezing rain was hammering the windows of Mercy Ridge's intensive care unit at 11:47 p.m., turning the city lights outside into long, smeared streaks of amber and blue. The ICU was a 12-bed ward on the 4th floor, its corridors a dim, humming purgatory of ventilator rhythms and cardiac monitor beeps. Mara stood at the central nurse's station, her dark hair pulled back in a tight, practical knot, reviewing the night's patient census with a methodical focus of someone mapping a tactical grid. 12 patients, all critical, all entirely dependent on the skeleton crew that had shown up for a Tuesday night graveyard shift. That crew consisted of herself, one other nurse, and a respiratory therapist. 3 people, 12 lives. The hospital had been hemorrhaging staff for months. Budget cuts, burnout, the relentless grind of post-pandemic attrition. The unit manager, a well-meaning but overwhelmed woman named Linda Torres, had spent the last 3 hours on the phone with the float pool and the staffing agency, desperately trying to pull reinforcements from a dry well. At 11:30 p.m., Linda had pressed a hand on Mara's shoulder at the station and said, tight-lipped, "I'm still working on it. You'll have backup by midnight." It was now 11:47. The backup hadn't materialized. The other nurse, a young man named Derek Paulson, was 26 years old and had been a licensed nurse for exactly 8 months. He was earnest, hard-working, and visibly terrified. He had never managed more than 4 patients on a stable medical ward. Tonight, he was co-responsible for 6 critically ill adults, including a 68-year-old post-cardiac surgery patient whose blood pressure had been trending in a direction that made Mara's jaw tighten every time she looked at the monitor. The respiratory therapist, Elena Voss, was competent and unflappable, but her scope of practice was a wall. She could manage airways. She couldn't push medications, hang blood, or make the 1,000 clinical decisions a crashing patient demanded. Mara did the math the way she had been trained to do math. Not with panic, not with paralysis. With cold, clear geometry. 3 people, 12 lives. 0 margin for error. "Derek," she said, walking past the station with the quiet, flat authority she could never fully iron out her voice. "Room 4's mean arterial pressure is drifting. Bump the norepinephrine by 2 micrograms. Document it and call me immediately if it drops below 65. Don't wait. Call me immediately." "Got it," Derek said, already moving, grateful for the direction. Mara moved to room 7, where an 81-year-old woman named Helen Marsh was 2 days out from a hip replacement that had gone sideways. Helen had developed a hospital-acquired pneumonia that was fighting back hard against the antibiotics. Her oxygen saturation had been hovering at a worrying 91% for the last hour. Mara listened to her chest with a stethoscope, her eyes closed, her expression utterly still. The crackle in the lower left lobe was wetter and more pronounced than it had been an hour ago. She stepped out and found Elena in the corridor. Helen in 7 needs positioning and a high-flow mask upgrade. Her secretions are pooling. Can you get in there? On my way, Elena said. Mara was already moving toward room 3. This was how the first hour passed. Not in chaos, but in a tightly controlled, relentless choreography of one person filling the spaces that a full staff of 8 should have occupied. Mara did not run. Running wastes oxygen and signals panic to patients who are already frightened. She walked fast. She thought faster. And she never stopped moving. At 12:14 a.m., the first crisis detonated. The cardiac monitor in room 9 emitted a single, jagged alarm tone that cut through the low hum of the ward like a blade. Mara was across the unit in room 2, adjusting a propofol drip on a ventilated patient, when she heard it. She didn't need to look at the screen. She knew the sound the way a veteran soldier knows the difference between a backfire and a gunshot. Ventricular tachycardia. Room 9 held a 52-year-old construction foreman named Ray Castellano. He'd been admitted 48 hours earlier after a massive anterior myocardial infarction. The interventional team had stent his LAD, but his ejection fraction was terrible. His heart was a pump running on fumes, and it had just started throwing a rhythm that was about to kill him. Mara moved, not running, but with a controlled, terrifying urgency that made Derek, standing in the hallway with a medication tray, press himself against the wall to get out of her way. She hit the crash cart outside room 9 at full stride, unlatching the defibrillator without breaking her movement, and pushed through the door. Ray Castellano was ashen, his mouth working in a silent, panicked gasp. His eyes found hers, and the terror in them was the raw, animal terror of a man who understands, on a cellular level, that he is about to disappear. Ray, look at me. Her voice was low, entirely calm. The kind of calm that is not the absence of urgency, but its highest possible refinement. I've got you. She slapped the defibrillator pads onto his chest, her hands moving in perfect sequence, no wasted motion. She checked the rhythm on the screen. Sustained VTach. Pulse still present, but thready, barely there. Cardioversion, she said to herself, because there was no one else in the room. Derek was still managing the patients she had just left. Elena was in room 7. Mara set the energy, checked the sync button, charged the device, and placed both paddles with practiced, precise placement. Ray, this is going to feel like a punch. Ready? He nodded, his jaw clenched, his knuckles white on the bed rail. Clear. She delivered the shock. Ray's body lifted off the mattress in a single sharp arc. The monitor screamed, went flat for a horrible half-second, and then beep, 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 beep. Normal sinus rhythm. 72 beats per minute. Ray sagged back against the pillow, his breath coming in a long, trembling exhale. You okay? He managed. I should be asking you that, Mara said, already pulling up his medication chart on the bedside terminal. She loaded an amiodarone infusion, checked the dosing parameters, and hung the bag herself. Your heart tried to run a sprint when it should be walking. We're going to slow it down. She was out of the room in 4 minutes. She had been there a total of 4 minutes. At 12:39 a.m., room 11's ventilator alarmed with a high-pressure notification. The patient, a 44-year-old woman with severe ARDS following a septic event, had developed a mucus plug. She was fighting the machine, her oxygen sats plummeting through the 80s. Mara called Elena, who was still managing Helen. Plug in 11. I need you as soon as you can. 2 minutes, Elena said. Mara didn't have 2 minutes. She went herself, performing a manual suction procedure that cleared the airway in under 90 seconds. By the time Elena arrived, the patient was synchronized with the ventilator again, her sats climbing back toward the mid-90s. Elena looked at the cleared suction catheter and then at Mara. How did you? Later, Mara said, and was already moving. At 1:15 a.m., Derek's voice came over the unit radio, 3 notes higher than his baseline. Mara, room 4. His pressure just dropped to 58/30. I pushed the norepinephrine like you said, but it's not holding. Mara was in room 4 before Derek finished the sentence. The man in room 4 was Gerald Whitmore, post-coronary artery bypass, 3 days out. He was pale and clammy, his body doing the unmistakable terrible work of going into cardiogenic shock. Mara looked at him, looked at the drip, looked at the monitor, and then looked at Derek. "He's tamponating," she said. Fluid was accumulating around Gerald's heart, compressing it, strangling its ability to pump. It was a post-surgical nightmare that could kill a man in minutes. "I need a pericardiocentesis tray." Derek blinked. "That's a physician procedure. I'll call the on-call resident." "Call them," Mara said. "But get me the tray while you're dialing." Derek made the call. The on-call internal medicine resident, a third-year named Dr. Anaya Patel, answered on the second ring. She was 30 minutes away on a different floor, finishing a procedure. She would come as fast as she could. 30 minutes. Mara looked at Gerald Whitmore's blood pressure on the monitor. 52/28. Gerald did not have 30 minutes. She did the thing that her civilian mind told her was an uncrossable line, and her other mind, the mind that had been forged in places that didn't appear on any public map, told her was simply the next correct action in the sequence. She prepped the tray herself. She localized the effusion by ultrasound using the bedside machine, mapping the fluid pocket with the practiced eye of someone who had drained worse things than this in far worse conditions. She positioned the needle, controlled her breath, and performed the aspiration with a steadiness of hand that should have been physically impossible at 1:22 a.m. after 90 consecutive minutes of sustained crisis management. 43 milliliters of hemorrhagic fluid drained from the pericardial sac. Gerald Whitmore's blood pressure climbed. 60, 70, 82/50. He opened his eyes. He looked at her. He said, with the voice of a man who had just been pulled back from the edge of an abyss, "Am I still here?" "You're still here," Mara said quietly, capping the needle. When Dr. Patel arrived 27 minutes later and reviewed the documentation, she stood at the bedside for a long moment, looking at the drained fluid in the collection canister, looking at the patient's stable vital signs, looking at the clinical notes that described every step of what had been done and when. Then she looked at Mara. "A nurse performed this procedure," Patel said carefully. "The attending documentation is pending," Mara replied, her face as neutral as a closed door. "You can co-sign." Patel looked at her for another 2 seconds. Then she pulled out her pen. The night did not stop. At 2:08 a.m., a new admission arrived from the ER. Massive stroke, large vessel occlusion, the window for intervention narrowing by the minute. At 2:31 a.m., room 6 feeding tube migrated into the airway, and Mara caught it on auscultation before a drop of formula reached the lungs. At 3:07 a.m., Derek, running on fear and adrenaline fumes, made a dosing error on a heparin drip. Mara caught it before it was administered, corrected it without fanfare, and spent 4 minutes with Derek in the corridor, making sure he understood what had happened and why, her voice never rising above a steady, quiet cadence that somehow didn't feel like a reprimand but felt like a lifeline. By 4:45 a.m., all 12 patients were alive. Not merely alive, stable. Every drip titrated, every airway secured, every critical parameter documented and trended and addressed. The night shift board, which had looked like a wall of red warning flags 6 hours earlier, was now a grid of cautious, hard-won green. Mara sat alone at the nurse's station. She pressed both palms flat on the cool laminate surface of the desk. For the first time in 6 hours, she allowed herself to be completely still. She stared at the dark window at the end of the corridor, where the Portland rain was finally tapering to a drizzle, and she breathed. She did not know it, but she was being watched. At 5:02 a.m., the elevator at the end of the corridor opened. It was not the staff elevator. It was the administrative elevator, the one that required a key card with a security clearance level that the average charge nurse would never see in their career. Mara registered this without turning her head. She had learned long ago to process her environment through peripheral vision. It was a habit that had outlasted the career that created it. 3 men stepped out. 2 of them were large, quiet, and wore the kind of careful, practiced stillness that Mara recognized as something other than civilian security. They moved in the deliberate, economical way of people who have spent significant portions of their lives in places where unnecessary movement gets people killed. The third man was older, late 60s, possibly 70. He wore a dark coat over what appeared to be a naval dress uniform, though no rank insignia was visible. He was tall, lean in the way of men who have remained physically disciplined out of habit rather than vanity, with close-cropped silver hair and a face that was a geological record of hard living and harder decisions. His eyes, from across the length of the corridor, were the color of deep ocean water. Not blue, exactly. Something colder and more complex than blue. He walked with a slight but visible hitch in his right leg. An old injury, something that had healed poorly or been healed under conditions that did not permit proper medical care. Mara knew that gait. She had seen it once before, briefly, through a scope lens in the thin air of the Hindu Kush, on a man being evacuated from a burning compound on a stretcher. A man whose extraction she had personally coordinated while lying flat in a rock crevice for 11 hours with a catastrophic fragmentation wound to her left side that she had packed with her own hands and willed herself not to bleed out from. Her blood went cold. She did not move. She did not turn her head. She continued looking at the patient census on her screen with the practiced blankness of someone who has been trained extensively at great personal cost to become invisible on command. The three men approached the nurse's station. The older man stopped on the other side of the desk. He looked at her. He did not speak immediately. His two companions flanked him with the quiet precision of men who had done exactly this, in exactly this formation, 1,000 times. "Mara Calloway," the older man said. His voice was low, unhurried, and carried the particular texture of a man who had never needed to raise it to make people listen. "That's right," Mara said. Her own voice was perfectly level. "Can I help you?" The older man studied her face for a long moment. His expression was not hostile. It was something more difficult to categorize. Something between recognition and grief. Like a man who has rehearsed a conversation many times and is now finding that none of the rehearsals were adequate. "I need to speak with you," he said. "My name is Admiral James Harwick, United States Navy, Joint Special Operations Command, retired." He paused. Though in my experience, retired is a relative term. Mara set down her pen with extreme care. She turned in her chair to face him directly for the first time. Her face was a mask. Her eyes were 2 degrees colder than the rest of the room. "Admiral," she said, "it's 5 in the morning. I've been managing 12 critical patients alone for the better part of 6 hours. Whatever you need to discuss, I'd ask you to be efficient about it." Something moved across Harwick's face. Not surprise. Something quieter than surprise and considerably more weighted. "I know what you've done tonight," he said. "I've been briefed." He glanced at the patient board, at the row of green indicators that should not, by any actuarial calculation of nursing ratios and crisis mathematics, be green. "I've also read your employment file. Both of them." The sentence landed in the space between them like a stone dropped into still water. Mara did not blink. "I only have one employment file, Admiral." "No," Harwick said softly. "You have two. The one that says Mara Calloway, license in Oregon, no prior employment history before 2 years ago." He reached into his coat and produced a sealed manila envelope. He set it on the desk between them. He did not open it. "And the one that says Lieutenant Commander Mara Voss, Combat Dive Qualified, SEAL Support and Reconnaissance, Naval Special Warfare Command. Decorated. Presumed killed in action during Operation Blackthorn Ridge. 3 years ago." The ward was very quiet. A ventilator cycled down the corridor. A monitor beeped its slow, steady rhythm. The rain had stopped completely, and in its absence the silence was enormous. "Lieutenant Commander Voss is dead," Mara said. The words were flat and final as a door shutting. "It's in the record." "The record is wrong," Harwick said. "The record," Mara replied carefully, "was constructed to keep people alive. Disassembling it has consequences." Harwick nodded slowly. I know exactly what it cost you to build it, and I know why you built it." He paused. "I also know what you walked away from, what you gave up." His voice was steady, but something in it had roughened slightly, like bedrock shifting. "I was at Arlington for your service. I folded the flag." A silence followed that had weight and temperature. Mara looked at the envelope on the desk. She did not reach for it. "Why are you here?" she asked. Because 6 weeks ago, Harwick said, we intercepted intelligence that suggested you were alive. And because 4 days ago, we confirmed it. And because the reason I needed to find you is the same reason you disappeared in the first place. His jaw tightened almost imperceptibly. Blackthorn Ridge wasn't a mission failure, Lieutenant Commander. It was a setup. The cardiac monitor in room 9 beeped steadily. Helen Marsh's ventilator exhaled its measured rhythm. 12 patients breathed on in their separate dark rooms, unaware of what was happening at the nurse's station at the end of the hall. I know it was a setup, Mara said. Her voice had changed, just slightly. The careful civilian monotone was still there, but underneath it, something older and harder had surfaced, like iron or an excavated earth. I've known for 3 years. That's why I disappeared. Harwick looked at her. Tell me what you know. She told him. Not all of it. Not the parts that were still too raw, that lived in the scar tissue on her left side, and in the particular quality of silence that happened when she woke at 3 a.m., certain she could smell smoke that wasn't there. But the operational facts, the intelligence that had led her team into that valley, the coordinates that had been off by exactly enough to put them in a kill zone rather than an extraction point, the shooter positions that indicated pre-knowledge of her team's approach vector, the Russian manufactured communication intercept gear they had found in the compound afterward, gear that required a very specific kind of American technical briefing to operate correctly. Someone had given her team to the enemy. Someone with access to operational planning at the highest levels of JSOC. Someone who, when the smoke cleared and 3 of her teammates were dead, and she was bleeding into the rocks with a fragmentation wound that should have been fatal, had made the calculated decision to list everyone as killed in action rather than mount a search. Because a search might have found her, and a found Mara Voss might have talked. So she had let them believe the record. She had stitched herself back together in a shepherd's outbuilding in the mountains with surgical supplies stolen from a compromised coalition forward base. She had walked out of that valley over 3 weeks, moving at night, resting in drainage ditches and ruined buildings, and arrived at a civilian border crossing looking like a refugee because she essentially was one. She had become Mara Calloway. She had gone back to nursing, the profession she had practiced before the Navy, before the SEAL support pipeline had identified her and pulled her into a world of black budgets and compartmented operations. She had gone back to the one thing she knew how to do that saved lives instead of ending them. And she had waited, because the people who had burned her team were still out there, still operating. And Mara Voss had learned, in the long years before Portland, that patience was not weakness. Patience was a weapon. Harwick listened to all of it without interrupting. When she finished, he was quiet for a moment. Then he reached into his coat again and produced not another envelope, but a tablet computer in hardened case. He sat on the desk and turned the screen toward her. On it was a photograph, a satellite image of a facility, and beneath the image, a name. Mara looked at it for a long time. He's still active, she said. It wasn't a question. He is, Harwick confirmed. And 3 weeks ago, he received a new operational brief. A domestic intelligence operation. Harwick's voice dropped further into a register that was very nearly inaudible. The target on that brief is a hospital in Portland, Oregon. He held her gaze. A specific intensive care unit, and a specific nurse who has been making a habit of performing miracles in the graveyard shift. The full geometry of the night assembled itself in Mara's mind with terrible clarity. The staffing crisis. The skeleton crew. 12 critical patients. A night designed, whether by budget mismanagement or deliberate engineering, to leave one specific person utterly exposed and occupied and alone. They were watching to see if I'd break cover, she said. They were watching to see if you were actually alive, Harwick corrected. And tonight, you answered the question definitively. Mara looked at the sealed envelope still sitting on the desk. She reached out and picked it up. She did not open it. How long have I got? She asked. There's a vehicle in the parking structure, Harwick said. 2 of my best people are in it. They've been in position since midnight. He paused. I had to be sure it was you before I moved anyone. Mara thought about room 4, Gerald Whitmore and his 43 milliliters of hemorrhagic fluid. She thought about Ray Castellano's heart, which had tried to quit and been persuaded otherwise. She thought about Helen Marsh's wet, crackling lungs, and the little stroke patient in the new admission bed, and Derek Paulson, who was going to be a very good nurse one day if someone didn't let him drown tonight. She thought about 12 people who were still alive, partly because she had not slept and had not stopped moving and had not allowed the mathematics of impossibility to override her obligations to the living. "I need 20 minutes, she said. Harwood blinked. Of all the responses he had prepared for, this was apparently not one of them. "Lieutenant Commander." 20 minutes, she said again. "I need to brief Derek on the full status of every patient and write a comprehensive handover note that ensures no one dies between now and when the day's shift arrives." She looked at Harwick with the absolute, undecorated directness of someone who has never confused urgency with importance. "Those people in there kept their end of the bargain. They stayed alive. I keep mine." Harwick stared at her. Then, very slowly, he nodded. 20 minutes, he said. She spent 19 minutes and 42 seconds. Derek Paulson received the most comprehensive patient handover brief of his short nursing career. Mara walked him through every patient in sequence, room by room, bed by bed, every drip rate and medication schedule, and early warning parameter and contingency plan. She spoke to him the way you speak to someone you are trusting with something irreplaceable, which is exactly what she was doing. When she finished, Derek looked at her with the expression of someone who has spent a night drowning and is only now beginning to understand what the shore looks like. "Where are you going?" he asked. Mara considered the question. She looked down the corridor toward the elevator at the far end, where Admiral Harwick and his two operators stood, waiting with the stillness of people who are very comfortable standing still. "There's something I need to finish," she said. Derek looked at the three men. Something in their posture, in the specific quality of their attention, made him very quiet. "Are you in trouble?" he asked. "Not anymore," she said. She pulled off her badge lanyard. She held it for a moment. "Mara Calloway, RN," and set on the desk. Then she turned and walked down the corridor. She was halfway to the elevator when Admiral Harwick took a step forward. He stopped directly in front of her. His two companions stepped aside with the trained, seamless precision of men who had done exactly this in exactly this context. Creating space. Bearing witness. Harwick looked at her. The ocean-colored eyes were doing something complicated. Something that had nothing to do with operational logistics or intelligence intercepts or 3 years of institutional grief. "Before we go," he said, his voice low enough that only she could hear it, "I owe you something." Mara waited. "I've been in this work for 40 years, Harwick said. "I've given a great many call signs. Some are functional. Tactical designators, nothing more." He paused. In the window at the end of the hall, the first gray light of Portland's dawn was beginning to press against the glass. Tentative, certain, but some call signs are not assigned. They're recognized. They're the name that emerges from what a person actually is, rather than what we decide to call them. He reached in his coat one final time. He produced a small, hard case. He opened it. Inside, resting in black foam, was a service decoration, a Navy cross with a second award device. And beside it, a folded card with 2 words written on it in precise, unhurried handwriting. "Phoenix. Returned. We've been calling you Phoenix for 3 years, Harwick said. In the classified briefs. In the memorials. In the arguments about what happened in that valley." His voice was steady, but it cost him. Because nobody who goes through fire the way you did and keeps pulling people out of it has any business being called anything else. The ward was utterly silent behind her. 12 rooms. 12 people breathing in the dark, every one of them alive. Mara looked at the decoration in the case. She looked at the 2 words on the card. She looked at the dawn pressing against the end-of-corridor window, turning the glass from gray to the palest possible shade of gold. She had spent 3 years being Mara Calloway. 3 years in the graveyard shift, in the quiet ward, in the careful anonymity of powder blue scrubs and a badge that said a name that wasn't hers. 3 years of staying invisible because visibility was a threat, and of saving lives because stopping was not something her hands knew how to do. And now, standing in the corridor of the ward she had held together alone through the longest night of her civilian life, she understood something that the 3 years had been quietly preparing her to know. She had not disappeared because she was afraid. She had disappeared because the fight she was actually needed for required that everyone believe she was gone. A phoenix doesn't survive the fire by running from it. It survives by going all the way through. She was all the way through. She reached out and closed the case gently with both hands. "Keep it somewhere safe," she said to Harwick. "I'll collect it when the job is finished." Harwick's expression shifted. Something that might have been pride or relief or the particular emotion that has no adequate name but fills the space between a commanding officer and an operator who has come home against all odds. "Understood, Phoenix," he said. The elevator doors opened. At 7:02 a.m., the day shift charge nurse, a broad-shouldered veteran named Patrice Odom, arrived on the fourth-floor ICU and stopped dead in her tracks. All 12 patients were stable. The drip rates were precisely calibrated. The handover notes were the most thorough, clearly written, clinically complete documentation Patrice had read in 22 years of nursing. Every contingency was mapped. Every early warning threshold was specified. Every critical trend was annotated with a plan. Derek Paulson was sitting at the nurse's station with his elbows on the desk and his face in his hands, not from despair, but from a bone-deep exhaustion that was also, somehow, the exhaustion of someone who had survived something significant. Patrice looked at the handover board. She looked at the green indicators. She looked at Derek. "Where's Calloway?" she asked. Derek lifted his head. He was quiet for a moment. His eyes focused on the window at the end of the corridor, where the Portland dawn had opened fully into a pale winter morning, cold and clear and clean. "She had to go finish something," he said. Patrice looked at the badge on the desk. She picked it up. She turned it over. "Mara Calloway, RN." She set it down. She looked at the green board. She looked at the 12 rooms and the 12 lives quietly sustaining themselves in the morning light. Whoever she was, Patrice said softly, she was good. Derek thought about Ray Castellano's heart, and Gerald Whitmore's drained pericardium, and Helen Marsh breathing steadily now in room 7 with clean lungs and a stable sat. He thought about the way she had moved through the night, unhurried and without hesitation, like someone who had been in worse places and had never, not once, let the darkness win. "Yeah," he said. She was. The monitors beeped their steady rhythm. The ventilators exhaled. The day shift took over, inheriting a ward that should have been a catastrophe and wasn't, because somewhere between midnight and dawn, in the graveyard shift that nobody wanted, a woman who was supposed to be dead had decided that as long as she was breathing, so were her patients. The badge sat on the desk for the rest of the morning. By noon, no one could account for who had left it there. But the patients in those 12 rooms all went home eventually. Every single one. Some people are called heroes in the bright light, in the loud moments, in front of cameras and crowds. And then there are the others, the ones who work in the dark, in the quiet, in the graveyard shift when no one is watching and the math says it's impossible. The ones who never stop. The ones who come back from the fire. If this story reminded you that heroism wears scrubs just as often as it wears medals, hit that like button and share it with someone who deserves to remember that tonight. Subscribe for more stories of extraordinary people in ordinary places doing the impossible thing, one patient at a time.